Well, folks, buckle up. We're in for quite a ride. America's health system is about to get a whole lot more interesting, and not necessarily in a good way. Robert F. Kennedy Jr., yes, you heard that right, RFK Jr., has been nominated for Secretary of Health and Human Services over the nation's health. A man with controversial views and a history of stirring the pot. It's like putting a chimpanzee with a blowtorch in charge of a fireworks factory. The potential for disaster is enormous. Sure, it'll be spectacular, but probably not in a good way. The stakes are incredibly high. Now some folks might be saying, John, isn't that a bit harsh, maybe even a little unfair? And to them I say, have you ever tried to navigate the American healthcare system? It's a nightmare. It's a labyrinthine mess that even seasoned insurance brokers struggle to navigate. Imagine the average person trying to make sense of it all. And we've just handed the reins to a man who thinks vaccines are a bigger threat than polio. A man who has publicly questioned the very foundations of modern medicine. This isn't just about politics anymore, folks. This is about the health and well-being of every American. This is about public health. It's about trust in our healthcare system. This is about whether we, as a nation, choose to base our health decisions on science or on conspiracy theories whispered in dimly lit Facebook groups. The choice we make now will echo for generations. Let's be clear. America's healthcare system is facing a perfect storm of challenges. We're talking about an opioid crisis that's claiming thousands of lives every year. We're talking about a mental health crisis that's leaving millions feeling lost and alone. And of course, we can't forget about the ever-growing chasm of health disparities. Rich people are living longer, healthier lives, while poor people are struggling just to afford basic care. It's a national disgrace, really. And into this maelstrom of problems walks RFK Jr., a man who seems to think that the answer to all our health woes lies in rejecting decades of scientific consensus. Now let's talk about the elephant in the room, vaccines. Vaccines have been a hot topic for years, sparking debates and controversies across the globe. RFK Jr. has made a career out of peddling dangerous misinformation about vaccines, linking them to everything from autism to, well, pretty much any ailment you can think of. His claims have been debunked time and time again by the scientific community, yet they persist. He's become the poster boy for the anti-vaccine movement, a movement that's already done enough damage to public health. This movement has led to outbreaks of diseases that were once under control, putting countless lives at risk. Now some might say, John, he claims he's not anti-vaccine, just pro-safe vaccine. But this is a misleading stance that confuses the public and undermines trust in proven medical practices. But here's the thing. There's no such thing as a pro-safe vaccine movement. Vaccines undergo rigorous testing and monitoring to ensure their safety and efficacy. It's like saying you're pro-safe driving while simultaneously advocating for removing all traffic lights and speed limits. Such a stance is inherently contradictory and dangerous. The science is clear. Vaccines are one of the greatest public health achievements in human history. They have been instrumental in controlling and eradicating diseases that once claimed millions of lives. They've saved millions of lives and eradicated deadly diseases. The benefits of vaccines far outweigh the minimal risks associated with them. And RFK Jr.'s crusade against them is not just misguided, it's downright dangerous. His rhetoric has real-world consequences, leading to vaccine hesitancy and outbreaks of preventable diseases. So, what can we expect from an RFK Jr.-led Department of Health and Human Services? This is a question on many minds as we look towards the future. Well, if his past is any indication, we can expect a lot of talk about toxins and big pharma. His history shows a consistent focus on these issues, often at the expense of other critical health topics, and not a lot of actual, science-based policy. This could lead to significant changes in how health policies are formulated and implemented. Will he try to weaken vaccine mandates? This is a major concern for public health experts who fear a resurgence of preventable diseases. Will he defund important public health programs? Such actions could have far-reaching consequences for communities relying on these services. Will he appoint other conspiracy theorists to key positions? This could undermine the credibility and effectiveness of the department. It's honestly too early to say for sure. The future is uncertain, and much will depend on his actions in the coming months. But one thing's for certain, it's not going to be boring. The media and public will be watching closely, ready to react to every move. So, there you have it, America. We are entering a new era with many unknowns. We're officially in uncharted territory. The direction we take from here is anyone's guess. The future of our nation's health is now in the hands of a man who seems to think that essential oils are a viable alternative to modern medicine. This perspective could lead to significant shifts in health policy. Get ready for a bumpy ride, folks. The journey ahead promises to be filled with twists and turns.